Yo, what's up, everybody? Dr. D. Let's talk about hair today. Hair is such a hot topic, and people just love their hair. Sometimes people don't care for their hair, and it looks good on them, like The Rock, the Vin Diesel, or not the Vin Diesel, etc. But most people like their hair and want to keep their hair and don't want to see their hair turn into colors they don't want, like when it turns into white hair, right? So today we're going to talk about how to preserve your hair as best as possible, and what does it really mean when you're losing your hair, or what does it mean when your hair is becoming white, and are there ways to reverse this, etc. So you guys know the approach we're going to take today is a biochemical approach. We're going to talk about the inside out. I'm going to give you a quick example. So if you take like a bottle of Pantene Pro V, I like to say this to all our clients all the time. On the bottle of Pantene Pro V, it's going to talk about like vitamin E. It's going to like, there's two little symbols, like fish oil symbols, little two fish oil capsules. And what is the implicit message right there that you see? So it's talking about things that you need inside your body. You need good oils, you need good vitamins, etc. Sure, we can put those on us, but think about it for a second. Imagine if you actually had adequate levels of vitamins and minerals inside your body. What would happen to your hair? Do you think your hair would be falling? Do you think your hair would be turning gray, etc.? So what is the pattern? Where does this usually start? So usually you'll start having weakening of your eyelashes, and then eyebrows, and then your hair per se, right? Or changes, right? Changes in color, etc. Of kind of in that order. Okay, for the most part, not everybody's the same, but for the most part, it kind of follows that progression. Okay, but when looking at the body and trying to understand how the body is aging, one of the first things that shows up is your hair. You can actually, you look at anybody, and sometimes people will tell you, hey, I'm X years old, but when you look at their hair and wrinkles and so forth, like, oh, geez, this person looks older than they really are. Or sometimes they'll tell you 60 or 70 or 80, and they have very, very little wrinkles and very, very little white hair. And they have sometimes still a full set of hair, and they look younger. So that's why I really believe everybody, including myself, we really like hair and skin. We'll talk about skin at another lecture. But for today, focusing on hair, hair is so cool and so important just to really help you to look younger and feel better. And even if you're not too much into looks, even if you're not too much into appearance, how you appear, but I will tell you, for certain people, it really helps boost their confidence on having a good appearance, and hair is definitely one of the top things on that list. Okay, so let's get into it. So your hair really starts to fall. It's a sign of aging. One of the first things that your body wants to survive. So once it sees it's starting to run out of resources and it's having to fight with things within itself that it doesn't want to be there. So for example, a lot of the toxic stuff that's in our environment, like excitotoxins and toxic halides, etc., those things start to affect your hair. And if you guys want to understand a little bit more about excitotoxins, toxic halides, and all these environmental toxins, we have other lectures on that. Please go watch them, and you'll understand how those things affect general health, affect hormones, etc. So when your body's trying to survive and it doesn't have the resources it needs, one of the first things that it starts to let go of is hair. Because think about it, it takes a certain amount of vitamins and minerals, etc., to keep that hair growing, to nourish that hair follicle, etc. So when you see somebody starting to lose hair or starting to get gray hair, usually there is a little bit of a pattern of biochemical insufficiency there, either a lack of resources or too much toxicity or a mix of both. Yes, there are people that have genetic predispositions to developing white hair, gray hair, white hair first, or losing their hair a little bit more rapidly. Okay, so does that preclude them from what I'm saying about the biochemical balance for there to continue to be proper hair growth? No. All of us will have certain genetic predispositions for things that we're not going to want to happen to us. But it's up to us to make sure that our biochemical environment inside of us is optimized the most so that we can continue to avoid those nefarious genes that are inside of us. So, and that's when we get into DNA methylation and the process of turning on and turning off certain genes, which we have other lectures on that. You guys can go learn a little bit more about that. But it's always that example that I like to give, just to give you guys a quick snippet of what the DNA methylation process is the process of turning on and turning off certain genes, like a piano and a pianist. You're the pianist. It's up to you to play the keys you're going to want to play. And then ultimately, the song you're going to be playing is the song of your life. Your lifestyle and what environments you put yourself in. And it can be an environment with a really nice refrigerator or an environment with a really bad refrigerator, for example. The refrigerator is your environment, right? It's the environment you're eating out of. So depending on the environment you're in and the lifestyle you're living, you're going to reap and sow the benefits or the maleficence thereof, right? So now, talking about a little bit about hormone optimization. So a big thing for people nowadays, both for men and women, is testosterone replacement therapy or supplementing with testosterone, etc. And you see that people start to lose their hair many times when they get on these protocols. And I'll like to say is many times it's not a detailed protocol. I won't say that it's not well done, but maybe there's not a full range of caution to what things can develop from being on testosterone replacement therapy, right? So testosterone, he converts into DHT. DHT stands for dihydrotestosterone. And here's a quick snippet and a quick clue. I would speak to your physician, for example, to men especially, to understand their DHT levels. Your DHT is the one connected with certain effects to the prostate and certain effects to hair. It makes you lose your hair. And I, for one, I've seen recently a few guys saying, oh, I'd rather lose my hair but have high DHT, because DHT is about 5 times more potent than testosterone. I, for one, keep my DHT levels under control. Now, there's things that you could use for that, for example, like finasteride or dutasteride. These are all 5-alpha reductase inhibitors. Now, the problem with using certain of these 5-alpha reductase inhibitors is that there's a lot of evidence showing that it can even affect brain health. There's an organization which I really like the work that they're doing, called the Post-Finasteride Syndrome Foundation.com. So I would definitely look into this. Don't take my word for it. Give it a Google and look into some of the work that they're posting out there. So finasteride is definitely something we don't stand for or use, or dutasteride, which is even stronger. Now, looking into natural things that God's left us here in His infinite pharmacology. And there's so many cool things out there, that some things that we don't even know about, like you've heard of vitamin B12, right? Well, have you heard of vitamin B15? How about vitamin B17? Yeah, so those things exist. Unfortunately, there's certain regulations that don't allow us to commercialize certain molecules, such as the ones I just mentioned. But there's a lot of cool stuff out there that really helps human health. So, and again, don't take my word for it. Go ahead and do your own research. Remember, always be sovereign. Don't listen or don't believe anything I say. Do your own research. Now, going into, let's go back into, so how do we stop that DHT and the progression of hair loss? And even if you don't do hormonal replacement therapy, you should check your DHT levels if you're concerned about your hair, right? So like you're in your 20 some year old guy or gal, it doesn't hurt to check those levels. Now, what do I really like to use or in making suggestions to our clinicians and those people that they're treating for preventing DHT? DIM. That's right, DIM. DIM, which stands for diindolylmethane. It's over the counter. You can get it at Whole Foods. You can get it or order it on Amazon. We always prefer using stuff coming straight from the pharmacy, so compounded. It's not patented, so remember I've spoken about this in other lectures. Big pharma can only sell things that they can patent. So that means, for the most part, it's things that are not in nature. DIM is readily available in nature. Now you ask me, where is it? It's inside cruciferous vegetables. It's all over the place. It's inside Brussels sprouts, kale, broccoli, etc. Shows great benefit even in certain cancer situations with women that have issues with, for example, that have the BRCA genes. So DIM is very, very beneficial in a lot of studies to help reduce the cancerous burden that can lead to that breast cancer. So DIM is just this little wonderful molecule that I really believe God has left us inside of nature to really help us with a lot of issues. So it helps men with their prostate, helps with hair, a lot, a lot. I personally can tell a huge difference in my hair, and I never did the follicle stuff, the FUE follicle replacements, but I was really struggling back then. So what are some things that I did? And here's some pictures of another client of ours, and we never touched this client's hair. It's just really optimizing this person from the inside out. So we start with basic stuff. So we start looking at, like, okay, what's this person's DHT levels? What are they really doing to increase inflammation, right? Is there a ton of gluten intolerance? Is there chemical toxicity? Do they have toxic halide poisoning like mercury, etc.? Why? Because these things are all robbing them from nutrients, right? Then we look to see what kind of nutrients this person has in their body. And are they missing nutrients, vitamins and minerals, antioxidants, and so forth? So we look at that. And then ultimately, we look to see where this person might be having excess inflammation versus resources to fight that. That's the first part. Then we add on things, for example, like DIM. DIM is very interesting, like I said, I've been speaking about it for the last few minutes, to really help block those DHT levels. And you'll see in blood work a pretty big drastic drop with DHT, PSA, which is prostate specific antigen, although it is considered in medicine perhaps one of the worst tumor markers. But it is, needless to say, it's always interesting and we get very happy to see that PSA coming down. Then after that, we look into some peptide therapy. Peptide therapy is very interesting for hair. There's many peptides out there that help a lot with hair. Things all the way from thymosin alpha 1, which now is patented. It's under the trade name of Zadaxin. And so it is one of the few peptides, along with, I believe, cerebrolysin as of this moment, that have become patented. And people will say IGF-1, although it is not per se a peptide. To be a peptide, it's less than 40 amino acids. If I'm not mistaken, it has about 72 amino acids. Now, it was 70 something amino acids. Pretty sure it's 72. Anyhow, point is, there are wonderful molecules out there, like the peptides, that help with restoring hair growth. So thymosin alpha 1, which would not be topical, it's an injectable, and you would do a protocol of this. It goes really well with glutathione, for example, which is not a peptide, it's an antioxidant. It's the universal toxin binder, as it's dubbed in the holistic space. Also, another really, really good peptide for hair would be zinc thymulin. And zinc thymulin actually shows some activity in reversing gray hair. So that's pretty cool. Don't think you have a set of gray hair, you're in your 90s, you're going to take some zinc thymulin and it's going to, no, unfortunately it's not like that. You could go to your hairdresser and maybe they'll actually provide more dramatic and drastic results than the zinc thymulin. But indeed, zinc thymulin for those people. So I don't have one white hair yet, and I'm looking to really delay that as much as possible. I'm going on 38, but um, zinc thymulin, for example, if I start to develop these white hairs, etc., that's something, for example, I would go on, right? Then also for hair growth, another really good peptide is PTD-DBM. Really, really interesting peptide for promoting hair growth. Works very, very well. And then another amazing peptide, which is found in the saliva, urine, and plasma. It upregulates fibroblasts and glycosaminoglycans and collagen synthesis. So it's good for skin. It's super interesting, this peptide. It's called GHK copper or GHK-Cu. And this peptide, really, really wonderful for hair and skin. It helps with decreasing fine lines and wrinkles. Furthermore, it's one of when you have tissue injury, your genes up or your biological system upregulates the genes that are associated to GHK to come actually heal tissue, etc. So it's kind of like the 911. When you have an insult to tissue, it's kind of the 911 where the body calls GHK to come help to heal you. So it's wonderful. I really, really like that peptide. I've used it tons. And that one you could do topical, foam for hair. You could do cream. You could do injectable. Works really, really well. One thing I do recommend you guys too, if you want to have some like surveillance to your hair, watch the DHT levels and get a follicle count. There's wonderful machines nowadays that can do wonderful things and actually count your hair, number your hair. So it's really interesting and we're starting to do that at Biohax, where you come to us and we'll actually see, hey, hair 1,438 is a little crooked today. No, I'm kidding, not to that extent, but we can actually see how much hair is on your head, and that really provides a quantifiable result as to the therapies that you're doing and interventions that you're doing. Right now, there's other things that you might do, especially if you're in the performance space, bodybuilding and being an athlete overall, where you might use certain substances to gain advantage in your performance that really hurt your hair fast, very, very fast. And that's another thing we don't stand by in our view, because we want performance and longevity to be connected. And not only longevity in terms of getting you to live longer, but also for your tissues to look better in older age, for your hair to look better in older age. So you have to always be cautious of the substances you're going to put in your body. So like I'm telling you guys, really to be proactive, look at your DHT levels, get a follicle count to see how much hair is on your head. And I'm sure many people watching this didn't know that there are machines out there that do this, and indeed there are. And that's something that we've invested in our organization to be able to provide more results. Heck, I want it for me, right? I like my hair. So important to understand also that there are different things that are going to be used to block those DHT levels or block the conversion of 5-alpha reductase, which many times they come in with harder side effects, like the finasteride that I was telling you guys about. Okay, and there's wonderful things out there like a lot of the peptide medicine that can really, really help to promote hair growth. So you will look at your DHT, you do a follicle count, you understand how much hair is on your head. You actually then, if you want to go a little deeper, you do a micronutrient study where you're looking at the vitamins, minerals, antioxidants inside your body. Then you understand inflammation to see how much inflammation's in your body. Fine, if you can't afford to do a big chemical panel and all that stuff, look at markers of inflammation, okay? Look at HSCRP, look at homocysteine, and maybe even look at a ANA. ANA is related more to autoimmune, etc. But if any of those three are elevated, whoa, hold your horses, there might be something there that's actually pulling resources from my body, okay? Then and speak to your physician about these things, because this might be new to the physician or just a different school of thought. But speak to your physician about this. But then after that, after collecting this data, consider perhaps blocking those DHT levels in a more natural way using, for example, DIM. And you can actually it's pretty crazy. You can actually see those levels come down very nicely. And then consider perhaps even some peptide therapy, and you could talk to your physician about that. There's a lot of good stuff in regards to peptides. And remember, peptides and stem cells, this is the first time in this lecture I'm mentioning stem cells, are all very regenerative. And stem cells, also very, very wonderful, just for overall providing your body just so much regeneration. For one, I do stem cells as well. We when I say we, me and my family, we fly overseas to get it done. But stem cells are wonderful. There's a lot of research in regards to how stem cells can help the body to heal itself in so many ways. And then as it relates to your integumentary system with hair, skin, it's at nails, all that stuff, you'll see such a big difference when you optimize everything and perhaps even include some stem cells. So, and I have examples of this all the time. Like I said, my hair, but my wife, my mom, I remember my mom before I got into all this. I mean, in medical school, I just remember her telling me all the time, oh my God, my nails are breaking, my nails are breaking, my nails are breaking. She would have these horrible gashes in between her nails. And since I started this, and obviously my family's, they're they're pretty fond of also doing their supplementation and collecting data on their body and see the progression of their health. Sometimes I joke with her, I'm like, how are your nails now? And she's like, oh my God, they're claws, they're super strong. So that's the thing, man. Your body will start to give you clues as it relates to how it's feeling with its health, as it relates to hair, skin, nails. Pay attention to what your skin looks like. Pay attention to what your hair is telling you. Pay attention to what your nails are also telling you. And your hair will give you the most subtle clues, right? And for example, I just remembered one. For a lot of guys doing hormone replacement therapy will really load up on something called anastrozole, which anastrozole is a chemotherapeutic agent for women with breast cancer. It's an aromatase inhibitor. But for men in hormone clinics, it's used heavily to block the activity of estrogen. We're also not a big fan of that just because of the chemical burden, and there's a lot of new studies coming out showing that, it's perhaps not the best for men. There's more natural substances that can perhaps substitute the effects of anastrozole. So DIM, for example, won't block aromatase, but it'll block the nefarious effects, as we just spoke about heavily, that estrogen can do. But chrysin, for example, seems to have some activity similar to anastrozole, and it's a lot more natural. Now, when you're taking anastrozole, you know what it does? It makes the front of your hair very burnt. And a lot of guys will notice that, hey, something's wrong with the front of my hair when they're taking that, because the anastrozole has a tendency to make that front of your hair very crispy, burnt, and an ugly appearance, right? So you can't really get that little Ricky Suave or Johnny Bravo look on. You can't really get the front part to look good. So, there's so many little clues as it relates to hair and your body, okay? As it relates to skin and your body. And we'll talk about skin more deeply in another lecture, but understand that your hair is giving you clues as it relates to your health. The longer you live and the longer you have nice, high quality hair, the more you'll appreciate this life, the more you'll love looking at yourself in the mirror, the more you'll feel good about yourself. When you feel good about yourself, you have confidence. When you have confidence, your whole life changes. When you ultimately trust yourself and you love yourself and you believe in yourself, that's the ultimate tool to get the things that you want out of this life. And just having a nice set of hair might help with that, all right? Love y'all. Dr. D. See you soon.